let's see here. So yeah, I'm going to be, Benavest point of contact for anything on the group side. I specifically deal with major medical. With that said, we have just about everything. What I see the most is dental vision, uh, and any work site, accident, cancer policies, things like that. So, medical, always feel free to come to me directly. For any other products, let me know and I'll make sure that you get the right point of contact there. So for the major medical side, we primarily do level funding. I'm sure most of you, have experience with this before, but for the ones who don't, uh, level funding is not traditional self-funding. It's acts as a fully insured product in the sense that, you pay monthly premiums. Any claims are paid on the front end with your medical card. The big difference is that it's underwritten. So, it targets groups that are from average to good health, and they see a lot of good cost savings there. A few other differences this slide will cover. So yeah, as I said, a big pro is lower rates, right? That's the big goal of going through the underwriting process is to get a fair rate, not the just standard rate based on date of births and things like that. All of our plans are ACA compliant, so you won't have any issues there. As far as commission, it leaves room for a high commission. So the standard is 7%. This can be dialed up or down. It can go up to 29%. Obviously, going up or down, will affect the rates. 7% is what's built in. So, you can decrease from that number, which will help lower the rates, or the opposite, you can increase. And, we always leave that up to the agents based on case by case. So, maybe one you'll need to dock some off, maybe the next one you'll need to add on, which is, totally fine. I'll go into networks in a bit, but yeah, we have flexible networks. The big one is obviously the refund at the end of the year. So that's the second big pro to the level funded product. And this is with other carriers as well, you'll get a claims account that pays for the group throughout the year. If they burn through that account and it's empty at the end of the policy, there's, no penalty there. It's just a reward for having a good year, essentially. So whatever's left in that account will be shared back with the employer. A couple unique things that Allstate does. Um, the group gets it regardless of renewal. So if the group decides to not renew for whatever reason, that money's still coming their way. Also, it's not just a credit to the next billing period. This is a check that's sent to the employer, and we leave it up to the employer to decide what they want to do with that money. How big the account is just depends on the case size, right? So we go from 5 to 50. So, obviously the smaller the group, the smaller that account will be. So it goes by case. Some cons to the level funded product is it's not a guaranteed issue product. So, if we get applications back and it's, there's a high medical load and the price skyrockets, they could decline the group. Most likely in that instance, we wouldn't be competitive there anyways. But it is an option, for the underwriting team to deny coverage. One more is just the underwriting process, right? That's the biggest hump to get over. It's the reason that they're going through it in the first place is to get, fair rates, save money, but it is a hurdle for them, right? So for Florida, any in-state group that's under 50 is going to have to go through the application process. There are other states where we can fully underwrite just based on medical history. So if you have any claims data from like the year prior, we can use that and give them a firm offer. But unfortunately, at this time for Florida, every group that's in that 50 and under category will have to go through the medical questionnaires. I wanted to take one quick step away from the PowerPoint just to give you guys a better understanding of those applications. There's a good layout here. So just so you guys have a better understanding, the group doesn't have to be spotless to get good rates. They're going to get fair rates as long as there aren't any real heavy hitters. So this kind of lays this out for you guys. Already considered, these are conditions we see all the time that isn't going to affect the rates greatly at all, like asthma, anxiety, high blood pressure. These, those are common conditions and not a big deal at all. when they come back. And then mild, obviously back pain, they're gonna ask questions about any upcoming procedures, things like that, that they're gonna have to rate for. These are really what to look out for, right? So injectable drugs is the biggest one that I see. Um, or the most common, big hitter that I see. Those, can be anywhere from $10,000 a month. They get really pricey, and the underwriting team will rate for those. So, I can obviously send you guys this in a follow-up just so you have it on file. But, it's a good question to ask the employer, like, hey, God forbid, but do you know of any employees that have cancer or, any upcoming surgeries, et cetera, just to, kind of get a better understanding if it would be a good fit for them. Okay, so this kind of goes more into the networks and different plan options for them. So the vast majority are PPO network plans. For these, we're going to have Cigna and Aetna. Cigna, that they'll have the OAP option as well as Local Plus. Aetna would be POS. Um, you know, a lot of companies like to have their in-network, and we can always go in, see if their provider, doctor, whatever is important to them is in network, and we'll quote them the most cost-effective option, whatever they like. And we can always go back in and requote, try to accommodate their needs. Some other ones, so the Advantage plan is just another way that, that's just the name for our HMO. So obviously they're going to see savings here just because it's only in-network benefits. So yeah, depending on, it could be under 5, I've seen over 15, just depending on location, how competitive these networks are in their area. Another option is reference-based pricing. So this is, going to be the highest savings